Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is a career in medical coding right for you? Some things to think about. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so I've been getting a lot of messages lately from nurses that are telling me, Blue, I've been 30 years on the bedside and I'm tired of it and I want to do medical coding, but I want to do this remotely. Is this right for me? Or Blue, I have kids at the house and I really want to do this from home. I want to work from home. Everybody wants to work from home. Let's just knock this off first of all, right away. The thing about a career in medical coding is that yes, some people do work from home. However, I do not, and I will never, ever recommend brand new people, regardless of your background, regardless of you if you came over from medical or not, regardless of how much education you have, I will never recommend that a new coder works at home immediately. Now, before you say anything, some people will say, well, no, Blue, I started in 2020 and when everybody was working at home and I've been just fine ever since then. I guarantee you there are a lot of things that you're missing out on because you didn't have that time and that development around other medical coders. Now, there are some positions that require in-house training and then you go home. That I would be more comfortable with than somebody just cold going in at home immediately, okay? And that's something that you got to know. This career field is not all that though. I mean, it's not all remote coding. It's not all about the remote that you can work at home and that kind of thing. This career requires much more than that. It is about reading. That is 90% of what we have to do in a day is read as medical coders. So if you are not a reader, do not pursue this because it doesn't get any easier. It doesn't get any, more quicker or whatever. It's going to require you to read. It does not matter that the provider pre-selected the codes. It doesn't matter that they have computer-assisted coding at this facility. It doesn't matter. You are still required to read. You are still required to comprehend what you are reading. Now, before people say, well, Blue, why would you say that? Everybody should know that. No, believe it or not, I've had many people tell me, well, Blue, I can read, but I don't like my comprehension. I get distracted easy and that kind of, no. It requires you to pay attention to what you're reading. The subtle nuances in health information documentation and medical records and all these things, it takes you to be able to look at what you're doing and understand it. It takes time to understand what we are doing every single day. Doctors get 10 to 15 years to be a doctor. Medical coders, if you're going through a decent enough program, 9 months, 12 months, or 18 months. Some people try to race through medical coding school faster than that because they think it's a joke or somebody sold it to them as being so easy to be able to do. And it's not. We have to know what doctors know while never having gone to medical school. And I don't say that so that y'all are scared, okay? I would never tell y'all things to scare you. I'm telling you the realistic truth in what to expect. Because there's a lot of people that don't do that. There's a lot of people that are trying to sell programs. I don't have a program to sell. I don't have credentials to sell. I do have services, of course, that I offer, like tutoring and professional coaching and resume writes and things like that. But that's not to do with this, like of a program, right? An actual program. I have an independent study that I post for free for you all to either supplement your studies at your school, because sometimes the school doesn't give sufficient enough materials to help you to learn. So people will use my independent study to help them to learn more. And sometimes people are just going through the independent study. And that independent study list and the syllabus and working through it has helped several people to be able to sit and pass for any of the 4 main medical coding certification exams. The CCS, that is a gold standard of medical coding credentials. The CCA, the CCSP, or the CPC. They've used that syllabus to help them. And it's always in the description box of all of my videos. So if you ask me, I will not respond because it's in the description box of all of my videos. So the thing that you have to understand is this. We work hard as medical coders because we're reading all day. And while some people may dismiss that as, oh, well, you have a desk job. That's not hard work. The heck it isn't. Because trust me, it is. I have worked as blue collar jobs before doing clerical work and being a medical coder, things like that. I've worked on my feet and in retail, and not retail, but in food service and things like that. And that's all physical hard labor work, yeah. So I know what it's like to be tired from doing all that physical hard labor work. However, it's just as tiring when you're sitting here having to read all day, trying to remember the rules, trying to remember what parts of the body does this, and what about this, and pathophysiology and pharma for this, and this for that, and this procedure and this modifier. It's a lot to think about, and it does wear people out just as much as if you were doing a physical labor job. So I don't want to hear it when people say, oh, it's just a desk job. It's not just a desk job. We have to actually think and use our brain. And that takes a lot of energy. And it can wear you out. But it requires us to have that focus and that concentration. And a lot of people don't have that. We live in that ticky-tock nation right now. Or this ticky-tock world where everything is 10 seconds or less. You get the hit of dopamine and it's on to the next thing. And you want things right here, right now. And that's not what this field is. Medical coding does not move quickly. It's a slow buildup. And what a lot of people don't understand is that things are not going to happen for you right away. And when you're out there and you're looking for your first job, people already want to be concerned about, oh, well, I heard people aren't able to find jobs. Those are people that are lazy as far as they don't do their research. Okay? Because if you're doing your research, then you would see in my videos how I'm telling you guys ways of getting in and things to do to help you to get a job. And some people will sit here and straight argue with me, or they'll try to. I don't respond to those messages, because if I'm telling you to get yourself registered with a temp agency and then you tell me, oh, well, I don't want a temp job, I want a real job. I was the same way in the beginning because I didn't understand, and now I get it because that was how I got my first job, was through a temp agency. And I tell you guys to Google temporary agencies for medical professionals. That's how you Google it. Temporary agencies for medical professionals, and you will see and there's always somebody that comes up, well, I tried to Google temporary agencies for medical coders. Did you hear what I said? Attention to detail. Temporary agencies for medical professionals, because that's going to bring up all of the temporary agencies that specialize in medical professionals. They may have medical coder positions. They may have medical biller positions, but they're hiring for CNAs, LVNs, LPNs, doctors, and that kind of thing. And sometimes these temp agencies are the ones that are competing for these jobs, these contract jobs from, these hospitals and things like that to code. And so you're able to get hired on a lot quicker with a temp agency because they just need somebody that is competent and can fill a seat for a short amount of time. But guess what? That gets you some experience for your resume. And that's how you start to get your job. But again, a lot of people don't want to hear that. They just want to complain about how hard it is to get a job. It is hard. You have to convince somebody that's asking for 3 to 5 years, which is the default, that you are competent enough. Because again, these employers are looking at these people that are cattle herded through these medical coding programs that promise you that you can be on your way to earning a high amount of salary in just 6 weeks, or heaven forbid, just 8 weeks. It's ridiculous. And it makes a mockery of our profession, and it really upsets me. It really does. I can't stand it when I see programs that are so short. And they say, oh yeah, we can teach you everything you need to know. No, you can't. Well, Blue, I'm a nurse. I can learn this. Not in 2 months, not in 4 months. You need time to learn it. And it's not a knock on your intelligence. Certainly not. Certainly not. However, I will say this. Even doctors have a hard time understanding what coding is, what the rules are, and why do we need to have all of this detail here? What does it matter? Really? What does it matter? Well, here's all the rules. Here's all the guidelines. Then I get Bleu, your speaking coder. Well, okay, now I got to break it down to you a different way. So trust me, trust and believe when I say that even nurses struggle to learn medical coding, it is not a knock on your intelligence. I have helped many nurses who have come to me after failing the medical coding exams multiple times. And they say, Bleu, I don't know what I'm doing, because they're trying to rush through, because they're trying to say that, oh, well, I'm a nurse, I should understand this. Oh, I did the coding, and their version of coding is just selecting codes from a super bill. That's not coding. That's selecting codes from a super bill, okay? Coding is actually looking at the documentation, understanding it, and applying the codes as they are appropriate, sequencing the codes as appropriate, not picking up certain codes or not picking up certain things because it's not relevant, or it's already included in that a particular diagnosis because it is a symptom. So there's all of that. But it takes an incredible amount of study, and it takes an incredible amount of patience with yourself. And if you're not willing to do that, that's a problem. And sometimes people get so sold on just the money and the promise that, oh yeah, you can work remotely. And that's just the hardest part for me as a professional when I hear this, because you get people that come in with this misunderstanding of what the career field is and thinking that it's so easy, oh, because it's already selected. You are responsible for all of the codes that are selected as a coder. When you enter in those codes, when you post those charges, it is your name that is on that claim. It is your name that is on those codes that were selected. So when they come back and they look, and they're going to see, why did you select these codes? And if you say, well, that's what the doctor wanted, or that's what my supervisor said to pick up, it's not an excuse. If you look at the AHIMA standards of ethical coding, you'll see that you have to code appropriately, and that you cannot code based on what somebody else wants, or based on just to go along to get along. You can't do that. If those codes don't apply, that's not applicable, or it goes against the coding rules, that's when you have to speak up and say something. It's important. Now, there are certain things at certain facilities that they'll have you always pick up, like if you see it because it's part of their statistics and that kind of thing. That's something that's completely different. But blatantly picking up stuff that is just not there, or was never even done, obviously that's wrong. You cannot do that, all right? So that's the thing that you have to understand. And it takes time to learn these things. That's why I always tell people, if you're going to get into a program, make sure it's 9 months, 12 months, or 18 months. Make sure that this program is training you to sit for the CCS, that's the Certified Coding Specialist, the gold standard medical coding credentials, the CCA, that's the Certified Coding Associate. And yes, even though it's entry level, you can still get the CCA and still get a great job with it. Why? Because I had it for 13 years. No one could ever tell me anything bad about the CCA. I had it for 13 years. And I changed hearts and minds about the CCA. Because you have to know a lot in order to pass the CCA. And for people who trash talk the CCA, I bet you could never even pass that exam. I'm just saying. Because it says, inpatient and outpatient coding. You're versatile and can go anywhere. Same thing like the CCS. Only the CCS says that you've mastered it. Okay? Then there's the CCSP, that's a Certified Coding Specialist Physician Base. That's all outpatient coding. And the CPC, the Certified Professional Coder, and that's all outpatient coding as well. So anytime you have a credential and you're out there and you're applying and you're really putting forth that good effort, that's the thing. That when you are in this business, that sometimes it's going to take a lot of no's before you get in. But it doesn't mean that it's never going to happen. If you want it instantly and right now, this is not it. If you want to do this because you want to travel and be able to work remotely, that's not this either. Because you have to be able to connect securely to the internet. And that is going to require you to be in a stable place. not roaming around the countryside. I don't know who thinks that. Who thinks that that is a good idea? Because the more you expose the potential for the records to be hacked into, if you're trying to be out there all willy-nilly connecting to the Wi-Fi, no, that does not work. That's not the way that this industry is. There are laws to protect health information. There are laws to protect health information. If you don't take it seriously, you're not going to last long in this industry. Okay? And again, I don't say these things to scare you. I'm trying to give people a reality check, because I personally am tired of these emails talking about how they want to work at home. They want to work at home. They want to work at home. When you miss out on being around other coders in the beginning and getting that camaraderie and getting that understanding that you can't get from books, you're going to lose out. I don't want to see people lose out. I want to see this industry continue to grow. And people are all, oh, what about AI? What about this? AI is a tool. Let's get that straight. It is a tool. Just like the encoder is a tool, just like CAC, the computer assisted coding, is a tool, AI is a tool. It cannot replace us with critical thinking. And if anybody else tells you, oh yeah, you know, they're clearly not in the industry, because there's a lot of people that try to do that. You work in the tech industry, go be with tech. This is health information. This is my industry. When it comes to knowing the difference, I know the difference. You don't. Somebody that's in tech, you need to stay over there in tech. AI is not taking over. AI is a tool. Let's keep that clear. AI is a tool. Okay? That aside, I will say this also. This is going to require you to be studying for 20 hours per week. There is no getting around that. Even if you have a full-time job, even if you do all these other things, you still have to be able to make that time. It is possible to make 20 hours per week. All I hear are excuses a lot of times. Oh, Blue, I can't because of this. Okay, well then you're either never going to learn medical coding, or you are going to take a really long time to learn medical coding. It's up to you. But if you study for 20 hours per week, you're consistent. And 20 hours per week involves listening, watching videos, or working through the workbooks. 30 minutes at minimum, 1 hour maximum. 3.5 hours per day in 5 days. That's 17.5 hours. I know you have 3.5 hours per day. I know you've got 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes on your drive home that you could be listening to something. Or at your lunchtime, you could be working with flashcards. Your break time, you could be working with flashcards. Right? And then 1 hour, you could be working at the workbook. You could be looking up codes and practicing looking up codes, because the majority of these exams is all about coding knowledge and skill. If you're not practicing, you're never going to learn it. But a lot of people want to sit here and go around in circles, not knowing if they should do it or not, wasting time instead of actually just picking up the book and doing the work. That's what it takes, guys. That's the kind of career field this is. You got to pick up the book, and you've got to work with it 3.5 hours per day in 5 days at 17.5 hours. And then you have just 2.5 hours on a Saturday or Sunday. And then you got the rest of the time for yourself. Everybody has that. And if this is important to you, if this is something that you want to do, you will make the time to do it. And I have done the ICD-10, the Medical Coder Challenge for 2024, which is to read the ICD-10 CM coding guidelines in their entirety 4 times in the month of October. I've got to tell you guys, I was very disappointed with the results when I posted it on YouTube, as the vast majority of the people, 66%, had not even started yet. Had not even started the challenge. We're already on the 13th. 66%. And you're supposed to read them 4 times. And even though you may not understand them, and you may be confused about what you're reading, it's not on you to understand it immediately. A lot of times these things happen. They'll start to click once you get into the field, and once you really start coding, then you'll start to understand. But the whole premise behind studying and reading the coding guidelines 4 times in this month for 2025. The ICD-10-CM coding guidelines for 2025. You can download them for free from the CMS website. All you have to do is just Google in ICD-10-CM official coding guidelines 2025, and you'll see the PDF come up immediately from the CMS website. And if you've listened to my videos before, I've told y'all how to listen to the guidelines, and no, I'm not repeating it, and no, I will not answer you if you ask me. Because I've repeated it so many times, and people want to get fresh and give me attitude about how, oh, it sounds so boring. The voice. You can change the voice if you want to, okay? But I'm not repeating how to do it for those that are ungrateful. And there was one too many, one too many. But that's something that you can do. And if you're trying to think if this is going to be a good career for you, take the challenge. It's free. It's not going to cost you anything. And again, you're not going to understand it, but just to kind of give you a little bit of a taste for free on the kind of information that you're going to be exposed to and the rigorousness of study. Test yourself to see if you can handle that. If you can handle completely as a civilian, right? Completely as a civilian, not even in a coding program yet, and you're trying to decide if medical coding is right for you, download those guidelines from the CMS website. Just Google ICD-10-CM official coding guidelines for coding and reporting, right? 2025, something like that. You'll see it pop up, right? It's the first one usually, and then you download those guidelines. And then you listen to them or you read them. Yes, it's 120 pages, but it's only because of the font size. That's all it is, okay? So don't panic. You can get through it that many times, okay? But go through it, read it 4 times this month. You still got time. Even if you got through it maybe twice, because you still have time. You still got a couple weeks. You could be listening to it. You shouldn't listen to it all in one sitting. You can break it up. But if you listen to it, and so that way it can give you that kind of like, okay, this is what it's like. This is what they listen to. This is what the guidelines are like. I don't understand it, but it's okay. I've already given myself a head start. So that way, if you do decide, hey, I do want to do this. This is a career field I think I would be interested in because, you know, I've done my research. It allows you to grow. This career field, I was so far away from when I first heard about it, because I didn't know anything. I didn't even know medical coding existed, and it wasn't until I was unemployed and I went to the workforce office, and you know, they have you go to these programs where they can say, you know, hey, we could pay for your school, and I said, well, I have nothing to lose. They're paying for it, and they could do accounting and beautician and all this. I went through the WIA at the time. Now it's WIOA. It's a program, and they'll pay for you to go to school. The only thing that you have to do is find a job in the field that you were trained. I have nothing to lose. So I said, oh, okay, well, I'll do accounting because I like numbers. I'm a numbers person. My case manager was like, why don't you do medical coding? Why don't you think about that? And I was like, oh, no, I don't do nothing with needles because I know everything, right? I know everything. And he's like, no, it's not, it's not needles. And then he explained that it's reading documentation and putting that information into codes and for statistics and for billing purposes. I said, okay, well, it sounds interesting, you know. And he goes, just go check out the schools. And that's how I got started in it. So this is from the time I started until now, complete difference in me professionally, obviously, but me personally, as far as being out there doing YouTube and things like that, and doing speaking engagements now, because I'm the one of the breakout session speakers this year for AHIMA 24, happening out in Salt Lake City in a couple weeks. I'm excited. But with that said, you know, trying to thinking about me 16 years ago versus me now, it's incredible. all of the improvement I have done in my life, and all of the opportunities that I've gotten simply because I'm a medical coder, simply because I work with health information, simply because I'm in this industry. The contacts that I have contacts, personal contacts from all over the world. Hawaii, Germany, Italy, all over the world, and of course, all over the United States. So that is something that I never would have thought that would have been me, right? Like, who thinks like that, you know? But that's me. And it's getting bigger and bigger and bigger every single time because of the channel. Naturally, the channel is growing and things like that. You know, I'm very proud of the channel. I started this channel 6 years ago, and I'm extremely proud of all of the subscribers that I've gotten organically. I don't have to pay for subscribers. Now, what other people do on their channels is nothing to do with me. However, I will say that for me, everything that I talk about, everything that I put out there is designed to help you guys. And so, like I said, if you found yourself here and you're thinking, should I get into this? Check out my other videos where I talk about the industry, and I talk about the different credentials, and I talk about school, and I talk about the tips, you know, the study tips and things like that. I don't recommend specific schools because I don't have relationships with these schools, but there's programs directly through the two main medical coding associations, the American Health Information Management Association, which is who I belong to, right? I'm a member of them. I have 2 credentials with them. I have the CCSP because I got that one first after I had my CCA. My CCA I had for 13 years, but the second I got my CCSP, my CCA was superseded, okay, which means I can no longer carry it. Once you get a higher medical coding certification, a HEMA will take away your CCA. Now, that makes me very sad, but I had to do what I had to do. So CCSP, and now I have my CCS, okay? In the same year, I got my CCS as well, okay? So CCS says I've mastered inpatient and outpatient medical coding. So with all that said, I continue to grow in this field, and I continue to share the things that I've learned and things like that. And if this is an industry that you think that you would be interested in, just make sure that you understand that it is about studying. I never stop studying. Never. And I will continue to study because it's just building on my knowledge. The more knowledgeable I am, the better a medical coder I can be, the more I am proficient for my providers. And with that proficiency, it helps the patients in turn, okay? Because they're going to have a really good medical coder on their side who's going to select the diagnosis appropriately, who's going to select the procedure codes accurately. And that's the thing, you know? So with that said, it's a lot of studying, and you can't give up. And it's going to be a long, hard road, especially if you talk a lot and you share about your journey, and you're going to have people who will give you their opinions about this and, oh, how it's going away and blah, blah, blah. Have no idea what they're talking about. Okay. I was told that when I started 16 years ago, and I'm still here 16 years into my career. And I would not have it any other way. But if I had to listen to them, I wouldn't be here. I don't even have an idea of what I would be doing right now. I have no idea. But if this is something that you've chosen for yourself, don't dawdle. Don't overthink it. Don't think that you're not smart enough. There's people who think that about themselves. Don't do that. You are smart. You can do this. It's just a matter of getting yourself some discipline and studying those 20 hours per week, and you will start to get it. You will start to get it. If you don't understand something doesn't make sense to you, LinkedIn is a great place to find mentors. Mentors will help you for free. If you need a tutor, you may have to pay a few dollars, but there's sometimes that's what you need. Sometimes you need somebody to explain it to you in a way that's going to make sense to you. There's a lot of tutors out there. I'm a tutor myself. My rate and contact information is in the description box below. So with that said, best of luck to you on your journey, guys. This is a wonderful career field, but it also needs serious people who are going to do right by it. And if you do right by this career field, you will see all the benefits that will happen. And like I said, if you are on the fence and you can't decide yet, take my 2024 Medical Coder Challenge. Listen or read the 2025 ICD-10 CM coding guidelines 4 times this month. Try. And if you can only get through it once or you can only get through it twice, that's okay. It's going to give you an idea of what we face. And you're going to have that already coming into the gate. You're going to have, oh, I've been through the coding guidelines a few times already. Wonderful. Then you're going to be prepared when you start going to school. Because you keep doing that, there will be no stopping you. Okay? The sky is the limit in this career field. You can do anything you want to. I'm saying. With that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If the video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.